What about light salt?
Well, light salts, there are two kinds of light salt. One has no sodium in it, and we wouldn't want that because you need some of the sodium. There is a mix salt, which is in a light blue container from Morton's, and that's sodium and potassium. That's not bad. But you don't have to go out of your way because you don't need anything special. Again, people get focused on this. This is like the elite drops people. They're all intensely focused on this. You can get salt and potassium everywhere. It's really easily available. Now, some people want to go and do special things, but you get some easily available potassium by having a little orange juice, or a little cranberry juice, or a little tomato juice. So it's easy. Okay? Some people go to the chemistry store and they're trying to find potassium there and measure it out with a scale and calculate it. Have some orange juice. You can get sodium everywhere. Our society is filled with salt everywhere. Pretzels, potato chips, soup, canned soup. The only way you can can soup and leave dead animal parts in a can for years and then come back and eat it later is they put so much sodium in there nothing can live. I mean, how can you have chicken noodle soup? How can you have a piece of animal flesh laying in a can for years? Well, they put so much sodium in there nothing can live. No bacteria can grow. So there's plenty of salt available.
That completely turned my stomach about soup.
Yeah.
I'll never eat chicken noodles again now.
Wow.
Just have a few more questions. The coughing, is that from the anesthesia?
Mm-hmm.
I have to cough, and I do have a lot of gas.
No, you don't have gas, you have the feeling of gas, right?
Okay.
And so it's not gas, it's your body's nerves to the abdomen are limited in their vocabulary. When God created us, He put all these fingertip nerves so you can tell the difference between warm and cold, and soft and hard, and wet and dry, and all these differences because of the variety and the number of nerve endings in your fingertips, and He put very few in the abdomen, and all they really could say is gas.
They're saying it.
Yeah. Well, that's not gas, though. That is because a masked man yesterday, while you were helpless, stabbed you 5 times, crushed your stomach, stapled it, and sewed on it. So some people are all doing all kinds of business. They'll call me and say, I want to take a Fleet's enema or something like that. And I'm going, no, that will not help. Or I want to take a Ducalox tablet. I want to take milk of magnesia or something like that. We're going, no. The sensation of gas is a misnomer. It's your body trying to talk to you and tell you, warning, alert, something happened down here, and I want to tell you what it is, and I want to say it's gas, because that's all they know how to say. It's not gas. It feels like gas. It's not gas.
Lastly, and we can go to someone else, my blood pressure medicine, do I continue till I go home and then talk to my doctor about weaning off?
No, every day you talk to me, and don't take your blood pressure medicine without talking to me.
Well,
Do not take your blood pressure medicine.
I already took my Zoloft, but I didn't.
You do take your Zoloft. You do not take your blood pressure medicine. We don't stop our antidepressants. We don't want you to stop your antidepressants. We talked about that yesterday, that your situation may change and you may have situational depression, and that if that changes, then you may be able to get off it in 6 months or a year, but you don't change that now, because there's a wicked withdrawal syndrome from Zoloft.
I have a question about that. I'm on a Effexor, and you said you just take that pill in the morning, this morning, so when should I take that?
Have you taken it this morning?
No, I didn't, because I didn't know when. I
Take-
just don't
you
want
can
to be
take it.
falling my head off tomorrow.
Okay. I think you can go 24 hours. When is your surgery? Are you first?
Or,
Fourth? If you want to take it this morning with a sip, you could do it. It's not critical for one day.
okay.
But if you're wound up and you
I
want to
know
take it
that
today, you can.
They said mine, there's a lot of depressive medicines last in your system for some days, but Effexor doesn't. And I know that for a fact, 'cause I have forgotten them a couple times, and
Yes,
yeah, I
Okay.
just get.
If you want to take it today, you may.
Okay.
Other questions? Good. Congratulations. Third? Jennifer, boy, did we have to give you anesthesia.
Because I wanted to watch it. If I wasn't so scared, I would have.
55 minutes, we bypassed 9 feet.
Wow. That's because of my size.
Mhm.
So much meat to this, right?
It was my guess, right. That's what I hope is a good choice for you. Because you're a bigger lady, and you have very severe fatty liver.
Okay.
But,
That's the whole alcoholic thing?
yep,
The fatty liver and all that?
that should get better. We expect that the weight loss will help your breathing. You also have terrible lungs. Terrible low oxygen. Scared the pants off my poor anesthesiologist. He was whining and complaining the whole
I know,
time.
he wasn't very He gave me an insulin treatment like the things that...
It didn't help, right?
It didn't?
No.
He seemed happy when he was done that.
Yeah. No, you're a good person to have this surgery.
Oh, yeah.
What we would predict from the things that you brought to us is if you look into your future without the surgery, it might not be that bright.
No, I knew that.
Yeah. Your oxygen is already quite low, and that what we would predict is when you have low oxygen, that often hurts the heart, and one of these days in the future, had you not had the surgery, you'd have a little irregular heartbeat, and it could be.
I've been having it, like I told you before, I was medically phobic. For the last 2 to 3 years, I threw out any doctor's blood requisitions. The only way she got me to get my blood pressure taken was to withhold my medication, but she knew scared me enough that I would get it done. I call it a phobia because it's totally irrational. There's no sense to it at all.
No.
Why I would have let myself...
Well, you can be
Yeah.
very proud of yourself. You toughed it out. You went through a major surgery, and those things are in the past. That's the path that you might have taken had you not had
But when I
surgery.
hear now that I had severe sleep apnea...
I think, well, we don't know whether it's...
worried that I,
yeah.
you know, that I'd
You had
maybe
terrible low
at
oxygen.
home been going below 60
Yeah,
at night, and I've been having dreams and waking up.
yeah,
Claustrophobic, or not being able to breathe, and
yep.
it's been getting worse.
That's
and
because you were
worse.
smothering, and your heart doesn't like that.
And I was waking up, and even on the van coming here, it was getting worse. I was a time bomb.
No one can say,
And I
no one can
knew
see
it.
the future, but if I were guessing, I think this is a good decision for you.
Thank you.
My pleasure.
It's perfect.
Yeah.
I'm not sick, I'm not sore, I'm a little bit afraid.
I don't think they can hear you on the internet. Could you say that again?
I'm afraid to say how great I feel.
I know, right. Are you superstitious?
If I didn't have to stay in the area, I'd be home with my kids tomorrow. But precaution is nice as well.
Other questions that you have for me?
Just the blood pressure and the insulin. I was pre-diabetic, or I was diabetic. They found out during my blood work for the surgery. I've been monitoring myself at home. It's usually high in the morning and normal in the afternoon. It's packed its spike. Yesterday, super high.
How high?
Yes, you had it more.
Huh? It's not high.
No, it was higher than that at one point, wasn't it? They gave me a shot of insulin anyway.
Now, why would your sugar go up right after surgery? How was your blood pressure? Did it go up also?
Super high, yeah.
Super high. What was it?
Like over 200,
It was 198 over 111.
Okay, now I want you, in your mind, I'm going to put a blood pressure cuff on your arm, and I'm going to measure your blood sugar, and I'm going to take a hammer and hit you on the toe.
Right.
What do you think would happen to your blood pressure?
Stop.
Okay. Now, while you were asleep, you know what I did? A masked man snuck into the operating room. Stabbed you. So your blood pressure goes up after this because of part of what we call the stress response to surgery.
Okay.
Very understandable, and that's going to go down. I'm sorry?
Everything's, I didn't take my own blood pressure medication. Yesterday I took one from that you had ordered, and that brought it down. It's been perfect ever since.
Right. So now what we want to do when you leave the hospital later today, get a wrist blood pressure cuff, measure your blood pressure several times during the day, and get some blood glucose sticks to measure your blood
Yeah,
sugar,
okay.
and we'll keep a close eye on those things. But what we hope and what we predict is you're not going to have high blood pressure or diabetes anymore after today.
Oh, awesome, thank
Yeah,
you.
it's pretty cool. It's actually life and death. It's life and death.
Thank you.
Okay, and then last but not least, Marianne, you took like every bit of anesthesia we had left. We had to go to another hospital to get more drugs.
That's really bizarre.
I know. We're going,
Because I drink like maybe once a year, I'll have strawberry daiquiri, that's it.
Well, you just have a liver that's that's ready to roll. I mean, it's a good, strong, powerful, effective liver. Your surgery took 44 minutes, and we bypassed 8 feet.
What, is my liver fatty liver?
Yes, it is. Moderate.
Moderate?
Yeah. And that should get better.
Okay.
And you said you're having some nausea.
Yeah, it's just, waves of nausea.
Okay.
And discomfort. I thought it was gas at first, and I'm walking around trying to get it to go away, but it's just the mask bad
You have mass man, right?
It's not too bad. It's not too bad. It's just a little discomfort.
But we still would prefer for you to take some pain medicine.
I took a lot of pain medicine last night.
That's my girlfriend.
Yeah. I was afraid to push the button.
Good, good. But now you push the button. Did you ask for pain medicine from the nurse?
No.
Okay. Remember that pushing the button is the baby dose. It's a real tiny dose.
Okay.
The really good stuff is behind the counter.
Okay.
So ask the nurse for it. A big slug of that today is going to help you get better more quickly. It'll decrease the cortisol. It'll decrease. It's a good thing to do. Yeah.
Okay, we'll ask for some drugs.
Yeah, when you guys go back upstairs, yeah, say Dr. Riley says I should have the Dilaudid. Now the Dilaudid also has the side effect of causing euphoria.
Yay!
Now anybody feel a little teary? No? Okay.
Not yet.
I was edgy. I was kind of mean yesterday.
Oh, a little edgy? Well, think estrogen patch.
Yeah.
Okay.
I thought of it as soon as I was getting really ornery.
Yeah, if you have a little bit of edge to it, and I see you're an estrogen patch can help. It can
Yeah,
help
well-
make this recovery a lot more enjoyable for everyone.
I've got a gynecologist appointment in a couple of weeks. That's why I have to get my estrogen patch.
No, I'm sorry. I would even do it today if you don't feel perfect.
Oh, okay.
Yeah. Yeah, you don't want a couple of weeks. Remember, the worst part of when you quit smoking is often the early part.
Mm-hmm.
The further you get away from the event, the easier it's going to be. So this week could be very rough. Not necessarily, but just be alert to that.
Yeah.
And listen, if you're really angry about something because somebody's cut in line or because, like the one lady said, my husband's a bad driver or something
Mm-hmm.
like that, those things, if they're bothering you, think estrogen patch.
Yeah, well, they're bothering me about breathing. I don't ready slug them until some stuff makes me breathe. Like, I can't. I'm getting as much as I can.
Right. I think estrogen patch.
Okay.
Yeah.
I'm feeling really dizzy and faint right now.
Okay.
Things like that. I took 2 salt packs since I got here, but just, I'm starting to get tingling now.
Okay.
Yeah.
Jennifer,
Yeah.
can we get her two more salt packs?
Salt pack?
Uh-huh.
Tingling in my hand and,
Mm-hmm.
going a little dark and off and on.
Okay. Well, we might have to take you back upstairs in a wheelchair or something like that,
Okay.
so. Well, that's everybody from yesterday. Other questions that we should talk about from yesterday? All of you support folks, sisters, any comments? You okay? And
That's actually good.
as we say, no runs, no drips, no errors, nobody left on base?
I have a quick question.
Sure.
About leaks.
Mm-hmm.
So, if there's no fever, you don't have really bad pain.
Yeah, a leak would be intense pain like you were shot with a gun this morning.
Okay.
So you could, almost all of our leaks show up on the first day. And so if you're doing well this morning, you're almost certain that you're fine. Not 100%, but most of the leaks occur right away.
And they're not a result of coughing or anything like.
Coughing doesn't make a
I'm
difference.
scared
It's
to
whether
cough.
don't be scared to cough. The big issue is whether your surgeon did a good job. And I feel like I did a good job on everybody yesterday. So the stitches hold with coughing, vomiting, whatever you need to do. The key thing is whether the sutures were placed in a good solid tissue, and if they are, you have nothing to worry about.
So from here out, we can only look at things getting better, pretty much? Or can we
No.
look at-
What we see is there's often a dip on the second day or the third day, and I think we might have heard that from some of the people in clinic on Tuesday, that they had kind of a bad day. There was one person who had a sore throat, I think she commented on, and then there was another complaint from one of the other people, and I forget what it was, but you often will say, think about it, it's common to see this recovery is a lot like having a bad cold. And we think that's a tremendous positive about major surgery, but it still can cause some unpleasant days where you have some aches or pains or something like that. So if you have a bad day tomorrow, you don't feel like going to see the sites are going out, I wouldn't worry about it. Just say, well, I'm disappointed that you have a bad day. I'm disappointed you have pain tomorrow. I'm disappointed you don't feel like you have a lot of energy. But, you just had surgery. And recovery is not like a straight line. It's kind of, you can have an up and then a little bit of a down. You can be great in the morning and then kind of fade in the afternoon.
I have another question.
Sure.
Orange juice?
Yes.
How is the acid different in the juice than the other acids that we avoid?
Well, we don't want you to avoid any acids.
Well, like the tannic acid in coffee.
We're not trying to avoid tannic acid. That's one of those elite drops
Oh.
kind of things.
Okay.
What's wrong with coffee? Nothing. I love coffee, and I wish to heavens to Betsy that I could see research that showed coffee was as good for you as green tea, because it is very, very difficult for me to go into Starbucks and ask, I'll have a green tea, thank you. And I really don't want to order that. I really want a triple skinny latte, And, but unfortunately, coffee's not been shown to be good for the stomach. It's not that bad. It's not terrible. And some people get confused. They say, oh, it's the caffeine. It's not the caffeine. There's nothing wrong with caffeine. If you need caffeine, have caffeine. You can have all the caffeine you want as far as I'm concerned. But what's the problem with coffee? Coffee is so widely available in our environment. Like in our hospital, you're never more than 10 yards from coffee. I can get you 3 pots of coffee within about 10 yards of where we sit right now. And on every floor I can get you coffee. Coffee is not terrible by itself, but I want to point out first, what are the biggest complications we worry about after the surgery? Number 1 is long-term risk is getting an ulcer or gastritis or an upset stomach. Okay? Now, how can we prevent that? Eat a healthy diet, don't smoke, don't drink alcohol, and drink or eat healthy foods. Healthy foods have increased rates, increased contents of vitamin A, C, and E, the antioxidants. And research shows that helps protect your stomach from ulcers and skin and stomach cancer. Okay? Now, if I told my patients, hey, it's okay to have coffee, how much orange juice would they drink?
Not as much.
Not a whole lot.
Not much at all, because coffee is, first of all, most of us start to like coffee. And it's hard, how difficult in this hospital would it be to find fresh squeezed orange juice? Do you know the Chance brothers? Slim and None? So I tell all my patients the foundational principles of our recommended diet is a healthy, fresh diet with fresh fruits and vegetables. So I tell all my patients, remember, I'm talking to the public, right? I tell all of you, eat a healthy diet, eat fresh fruits, orange juice, healthy things. And you know what they do? They drink coffee. They just don't drink quite as much because I've told them to do this. If I told them they could have coffee, they'd have 10 cups a day. Now, the coffee itself, the soda pop, those things are not inherently terrible. They're not good. They're not great for you. There's no research I know showing that soda pop is good for you. Right? And but orange juice with its antioxidants, tomato juice, grapefruit juice, those things are great.
For the acid.
Okay, I'm coming to that. So they are great because they're antioxidants, and because lots of research shows it helps protect the stomach, and coffee does not. Okay. Now another great question, which you're trying to get me to answer, and I apologize about being delayed in getting to it. But that is, Dr. Rutledge, when I drink orange juice, that acid hits my stomach and it burns like crazy and I feel bad, or I'm worried about the acid in orange juice hurting my stomach. Okay? Good question, right? The stomach is very specialized. It's one of the only organs in the body that's protected against acid. So you should be able to pour hydrochloric acid into the stomach, and you would dissolve a piece of chicken, which is just meat, but it won't touch the lining of the stomach at all, because of the miraculous lining of the stomach and the mucus that protects the lining of the stomach. Right now in your stomach, there's a vat of acid there, which is ready to dissolve a pizza if it were to come there. Now, but also, You may have noticed occasionally if you drink orange juice it can upset your stomach or you have some burning pain.
I haven't.
You haven't? Some people have.
Okay.
So the question is, should we avoid orange juice because of the acid? And the answer is no. If you notice that you drink orange juice and you have some discomfort, then the answer is not to avoid orange juice, it's to fix the problem. Because if you feel discomfort when you drink orange juice, it means you've got an ulcer or gastritis. So that's a diagnostic test that I want to hear about. We want you to drink orange juice and grapefruit juice and tomato juice. And if it bothers you, we want to fix the problem, not stop drinking the juice. And we have a lot of people who come to us with reflux or ulcers or things like that, and they've given up a lifetime of fresh fruits and juices and things like that, because when they drink it, it burns the area of the esophagus or the stomach. We don't want that. We want to fix the area that's burned and keep drinking the juice. It's a really good question, kind of a subtle point, but it's a really big issue for us.
So does iced tea fit in the same category as coffee?
Well, regular iced tea is what's called black tea. Okay. Now, again, I earnestly wish that the research on black tea was as good as green tea. And I don't like to tell you this, but it really bugs me. But the research on black tea shows it's not as good as green tea. And regular old iced tea, black tea, is really green tea. It's just been dried a little bit longer. So it's very annoying to me to tell you this. I don't like it. But basically the research is very impressive. Green tea protects against prostate cancer. It helps with weight loss. It kills the bad bacteria that causes ulcers. On and on and on. And that's not true in a lot of cases for black tea and coffee. I wish that it were. But green tea is good. Black tea's not terrible, but green tea is really good for you.
What about white tea? Completely different.
White tea's even better. It's just less processed green tea. I don't like
What
it.
do you order when you go to Starbucks?
I order a green tea.
A green tea latte or just green tea?
I order a green tea.
You have to taste for it. Green tea's really good. I drink it every day.
I love green
It's
tea.
really good. I'm bad.
I don't like it. But I order green tea. I drink green tea. I have green tea at home. I drink it. I mean, you know, I don't want to have prostate cancer. I mean, you know. But now, I will tell you, that as long as nobody on the internet ever says this, but I do occasionally have a cup of coffee. And I think it would not cause you to die if you have one cup of coffee occasionally. But in general, the foundation of your diet, if you want to protect yourself from the complications of the surgery. Now let me give you another story. You guys are all paying me a fortune for my medical care. Now, presumably, one of the reasons you came here is because I sew and cut and tie knots well, right? That's why you paid so much money. But the other reason that you ought to take advantage of me is because I have 4,000 people that I've operated on who have my cell phone number. Okay? And let me tell you that I'm going to advise you to eat a healthy diet, to not drink coffee, not smoke cigarettes, and not drink alcohol. And I made that recommendation for 10 years. And you know what? A lot of people have ignored my advice. And you know what? They call me in the hospital with a perforated ulcer, with a bleeding ulcer, with abdominal pain. Okay? So, it's a good reason to come to me for my technical skills, but also because I got 4,000 people over 10 years who I've been following. I know what you should do for this surgery. I don't know what you should do as far as buying a new car, investing in the stock market, painting your house. But the MGB, I know. Drink green tea and fresh squeezed orange juice and a healthy diet. Don't drink alcohol, don't smoke cigarettes. If you do, keep my number, because you're going to be in the ER with a bleeding ulcer or a perforated ulcer or something bad.
You can do the cold green tea, right? Like just like
Sure, temperature doesn't make any difference. Now, but a lot of green tea has artificial sweeteners and stuff like that, so you have to be careful how you're getting it, but...
So if we were to drink white tea, which basically comes in the grocery store in a bottle, try to avoid the diet white tea that they have, just do the regular one.
Well, again, see, what you've done is you've made it more convenient for yourself, which makes perfect sense. You're going to say, I don't want to go around and have to make my own tea and stuff like that. So if I get in a bottle in the fridge, that'll make it easier. If you look on the side, look what's in it. If it's got a ton of sugar in it, it's not great.
Yeah.
If you have the diet version, I don't think that's great.
No.
So you have to look. There are some green tea, iced tea, things like that, that unfortunately are not that great. They have taken green tea and they said, don't worry, we'll fix you up. Like when yogurt came to America, people were going, I'm not going to eat this, it's sour milk. They said, don't worry, we'll fix you. So you know about TCBY? It means this is not really yogurt?
Yeah, that's what you'll play is, not really yogurt.
Yeah.
So what kind do you recommend then?
They should have, the yogurt should be kind of taste like sour milk. It should have the active cultures in it. And if it tastes like candy or ice cream, I'd be a little suspicious it's not very yogurty.
So is it Activia?
Active is a new one where they tried to add some different bacteria. And probiotics or bacteria, there's lots of good research. Like green tea, it's good for us. It's good for your gut. It helps protect against the bacteria that causes stomach cancer. So more good bacteria, more probiotics are better.
So that brand is okay?
I think it's okay. It's got bifidobacteria in there, and we like bifidobacteria.
Stonyfield?
Stonyfield is good.
Stonyfield,
Yeah, now I think they have sold out to a big corporation, but they're still pretty good. And we like, if it's separate, a lot of times, that if you take a bite of the separated yogurt and it tastes like sour milk, that's a good indicator that it's pretty good, and it hasn't had a whole bunch of things. Now, we found a lot of people get upset stomachs and gas and diarrhea if they eat non-fat and sugar-free yogurt, because they put other things in there that sometimes are hard to digest for our patients who have the bypass.
Is it okay to do goat milk yogurt?
As far as I know, I don't know anything special. I don't know that much about goats or their milk, but I assume
It
that
seems the same, because I've
then
been
I'm-
eating it, and I prefer it over
Sure.
cow milk.
Yeah, because a lot of people, we've had a lot of Middle Eastern people, and they've asked us about kefir.
Yeah.
Okay.
Kefir.
Kefir.
Yes.
Kefir?
Yeah,
Yes.
Kefir
It
solid-
has
solid-
like 8 different.
Yeah, and it also has a bacteria in it, doesn't it?
Yes.
Yeah. I'm not quite, I'm not,
It's just before it becomes yogurt. It's like a liquefied.
get him! He's about to become yogurt.
That's right.
Whey,
It's-
more like
it's-
whey.
It's like whey, yeah.
Okay. Well, whatever, then that sounds reasonable.
I went and bought all those flavored yogurts. Is that not the right move?
Flavored yogurt? What do you mean by
Like-
flavored?
Like the low sugar, well actually low fat, banana cream pie and.
Maybe.
The second ingredient you'll play is high fructose corn syrup.
Right.
Yeah.
And you should never eat high fructose corn syrup. That's what makes you gain weight really fast.
So all those yogurts are pretty good.
Well, nothing's terrible. You don't want to jump out the window. But basically, when we say yogurt as a good choice, you want sour milk. That with lots of bacteria in it. That we think is good. Now, you can also go to TCBY and get frozen yogurt. Not so good. Then you can eat things called Go-Gurt.
My kids love go-gurt.
I know, yeah. Yeah. I had a patient of mine who's actually worked for me in North Carolina, and she called me laying on the floor doubled up. And I said, well, it's dumping. She says, no, I've just been eating yogurt. I said, no, tell me what you're eating. She was doubled up in pain. Oh, my gosh, I'm dying. You know, I said, tell me what you're eating. She said, just yogurt. I said, it's not yogurt. No, it's yogurt. I said, not yogurt. She says, well, it's the kids' stuff. It's the yogurt they eat. It's called Go-Gurt. I said, go get one. She crawled to the refrigerator, and I said, read what's on the back, and it's sugar, high fructose corn syrup, milk solids, and stuff like that. So that's not yogurt.
So what's the brand then to get in the yogurt then?
Well, I don't care what brand you get. If you open the top of it and look at it, you see sour milk in there and it tastes like sour milk, that's yogurt.
I've also eaten.
If you eat it, it tastes like candy or ice cream, it's probably not yogurt.
If you eat organic
Yeah.
yogurt's good. I do add flavors in organic yogurt, but it's pretty hard to power that stuff down. But pretty much the ingredients, there's just milk and
Yeah.
Nancy's and
But
Brown
low
Cow
fat,
is
right,
also really good.
yeah, low fat and sugar free, in my opinion, although they make perfect sense, makes perfect sense to get low fat and sugar free, the research, in my opinion, doesn't support that that's going to help you lose weight. Okay? If you trick your stomach into getting something sweet by putting in an artificial sweetener, the research, I think, shows that your body will wait for you later and eat pizza to make up for that. You can't trick Mother Nature. I think. In other words, have you heard of any research where they said drinking Diet Coke helped you lose weight? Me either. How about Diet Pepsi? Any Diet Pepsi research? No. If there was any research like that, don't you think we would have heard about it? I think so too. Now, if you were making diet drinks like that, don't you think you would have tested it also? So I bet you that research actually has been done. But well, we haven't heard about it, because you know why?
Yeah.
Hey, good morning.